up there. I can see the feed in our IT help there. So I'm going to keep going, and then we're going to just try to get this started. Thank you, Pueblo, for joining us tonight. Like I said, I'm John Rodriguez, Director of Communications for the City of Pueblo. Here with me is obviously the Mayor of Pueblo, Nick Gradisar, Randy Evitz, Pueblo Health Director, Dr. Randy Urbina, Medical Officer of the Pueblo Department of Public Health and Environment, County Commissioner Garrison Ortiz, and Heather Graham of Graham's Grill and Restaurant owner and small business owner here in Pueblo. So I don't know what you can see, if you can see our thumbnail heads, but they're going to wave to all of Pueblo and see if we can pick that up. And if we have any connections, that we'll just go right through it. So tonight's meeting and tonight's town hall, we're going to talk about the curfew. We're going to talk about how COVID is impacting our community. And we also invited Heather here to talk about what small businesses in Pueblo are facing. So with that, I'm going to first give it off to our mayor. And if you could give us an update on COVID-19, and then we'll take some, we'll go through our officials here tonight. And then we'll take some questions from Facebook and or the questions that were submitted to us by email. So Mayor, I'll throw it off to you.
All right. Thanks, John, and welcome everybody. And special thanks to our guests who are joining us here this evening for this discussion with the community. Obviously, this is the Community Connections for November. It's been a strange year. And last week we had a Community Connections indoors in person, and you know, that's no longer possible. You've all been following the news so that you know that our COVID-19 cases have really spiked in Pueblo in the last month. The month of October was a bad month, and Randy can give us more specific information. But and November's starting out the same way in terms of the number of cases. It looks to me like the report I got was yesterday there were only 20 new cases, as opposed to the 3 days before that, there were more than 100 new cases in Pueblo every day for those 3 days. So we have a lot of work to do to get on the right side of this. Obviously, what we're trying to do is keep the rate of infection slowed down so that we do not overwhelm our medical facilities. And quite frankly, that's about where we're at this point. Between Parkview and St. Mary Corwin Hospital, we've got more than 50 COVID-19 patients in the hospital. Parkview has 20 ICU beds set up for the COVID-19 patients, and those are occupied 98% of the time. Those beds are full. So I know this has been a tough week. I imposed a curfew once I saw the numbers and start getting out of control, with the idea in mind that we could perhaps help people change their behavior. So it's so absolutely critical that we get people to wear masks and that we get people to maintain that social distance and minimize their interactions with people outside of their immediate household. That's how this infection is spreading. And if we don't do that, the numbers are going to continue to get larger and larger. And unfortunately, on the dial that the state of Colorado uses, once you get into those numbers, you sort of automatically go back into a different stage of dealing with the virus. So right now, our numbers for a 2-week average are really in the stay-at-home range. Last time I looked, they were a little over 500 new cases for a 2-week period. And we want to avoid that at all costs because obviously our business community, our economy is the lifeblood. That's what the city and county depend on for their income is sales tax. So we want to keep those businesses open, but they've got to be done. That has to be done in a safe manner. So I guess one of the messages I would have to the business community is you need to help us with this by making sure that your customers are complying with the rules. I mean, if they're not wearing face masks, you need to ask them to leave and just let them know that, you know, this is important because if, as I say, if the infection gets out of control, some bad things are going to happen in terms of what we have to do to the economy. So I think it behooves all of us to really get there. We know what has to be done. We just, not enough of us are doing it. And we need everybody's help to try to get it done. And this is not just a problem that's unique to Pueblo. It's, throughout the state, and it's just very difficult. And I know people are tired of it. I'm hoping now that the election is almost over, that perhaps we'll have a more unified message in terms of, how we're going to address this virus and those kind of things. But I still think we've got a ways to go. And what I want to do is try to maintain the most level economy we can for as long as we have to be in this without going through these shutdowns and opens ups and all those kind of things. So with those introductory remarks, I think I'll leave it there. And let me call on Randy Evans. Randy, you want to make a couple of opening statements?
Thank you, Mayor, and thank you everyone for joining us tonight. We're in a tight place right now with our numbers. As the mayor indicated, across the state, we've topped 800 hospitalizations this week, and that number is likely to quickly, in the next few days, pass the numbers that we were at in April in terms of hospitalizations. Currently, at the state level, the positivity rate is running about 9% for the last 7 days. Outbreaks are at an all-time high, and systems are being overwhelmed, as the mayor indicated. Our hospitals are starting to be concerned about the numbers. In terms of public health, our ability to do case investigation and contact tracing on the volume of cases has been severely reduced across the state. Locally, since this virus began, or since we had our first case in March, we've had over 2,500 positive cases. As I indicated today, hospitalizations are higher across the state, and in Pueblo, they've already exceeded the numbers we had in April. As the mayor indicated, I believe there was 54 hospitalized this morning in our hospitals. Our 2-week incidence rate is about 546 cases per 100,000. So multiply that by 1.68 or 168,000 to get our numbers right now. And our positivity rate's running about 8%. Remember that even through all of our testing and our work, that we're only identifying about 40% of the cases that are actually out there. So if you want to look at that, that's more like 1,300 or 1,400 cases per 100,000 that we have currently in our community. Our testing, which is really a good thing, our numbers that are at an all-time high. Monday through Wednesday of this week, we had over 2,200 tests just at our community-based testing site. And there's additional testing going on throughout our community. Currently, we've had 52 outbreaks in local businesses and organizations, and 34 of those are currently active, meaning that in the last 28 days, they've had at least one additional case or have had 2 cases that were connected or have continued to have cases. And those do not resolve until they have 28 days without an additional case. As the mayor indicated, because of our current numbers, we're currently in mitigation as a county. And this was really, as the mayor indicated as well, that this is not really a choice that we can make. We are responsible for dealing with it. And we did put some measures into place to try to implement a mitigation plan with the intent of, 1, trying to improve our health in the community, and 2, trying to keep our businesses moving forward so that we're not put into a higher level of restrictions. And so I think that sort of frames the situation for us. I think, like the mayor said, I think we're all tired of the masks. We're all tired of the lack of normalcy that we've had for the past 7 months. But this is probably the most critical time that we've experienced so far in this virus. And I would just echo the mayor's remarks that we cannot let our guard down now. We have to be diligent, and we really need everybody's help. Public health or the elected officials can't solve this alone. We have to ask for our citizens to help us and to help us make the right decisions and exhibit the behaviors that help our community to move forward. And I think, Mayor, I'll stop there for.
Okay. Thanks, Randy. Let me introduce a small business owner in our community. Heather Graham. Heather has 3 eating establishments that I particularly like to patronize. Graham's Grill, one on the north side, one on the south side, and Ruby's. Had a chance to have some wine and some appetizers there a couple of weeks ago with an out-of-town guest. And also, I think she and her husband owned Pueblo Athletic Club. So they're obviously very involved in the business community here, and from what I've been able to observe, working very hard to make sure that their businesses are complying with the rules and regulations. So Heather, why don't you tell us briefly what it's like being a business person, a small business person in this COVID world?
Yes, good evening, everybody, and thank you, Mayor Gradisar, for inviting me to join all of you tonight and speak upon the small business community here in Pueblo. I was kind of asked to talk about what it has been like being a small business owner during COVID. And, you know, this all started in March. On March 17th, my husband and I had to close all 4 businesses in one day. That's all of our revenue that we have, you know, as a family coming in, just like that, gone. We had to lay off 100 people between the 4 businesses. We did keep one of the Grams open and do to-go orders. So since then, we've months operating like that. The restaurants were ready to open and able to open the end of May. Where we were opened at 50% capacity, and that it wasn't so bad for us because, you know, at Ruby's we have all the outdoor seating, and we did receive a grant from Pueblo to build the patio that I have at the Southside Grams, which I'm able to seat more guests out there. So that helped make up for the limited capacity. But now coming into the winter months, it's going to be very difficult for us, especially at Ruby's. You know, we do have a small space there. We have fire pits and people are enjoying that right now. But on the colder nights, you know, sometimes we don't really get any customers at all. So that's kind of awful. You know, in April, I did receive PPP funding, and I was able to bring back all of my employees through one restaurant where, you know, we just had them clean and do takeout orders because we weren't fully open. So we didn't really get to utilize the PPP funding because we received it so early on and we were still shut down. So we've been living at this 50% capacity, you know, all this time now, and what I really want to make people understand is we're at 50% capacity, but we don't have to pay 50% of our bills. You know, we're still paying all of our rent, all of our mortgages, all of our utilities. Our fixed costs don't go down for any small business or any large business for that mean. In the near future, you know, tomorrow, maybe next week, maybe this weekend, the cases in Pueblo are so bad, I'm sure that we will be moved to level 3. And level 3 for one of my businesses simply means I will be able to have 10 people in Ruby's, and that's very detrimental. We won't be able to open only having 10 customers. The overhead will keep coming, and that's pretty bad. It's frustrating, you know, to the small business owners that I've talked to, because if we go to the big box stores, like today, I visited 4 of them, and there's tons of people in there. Very little restrictions in big box stores, and so it's hard when you're a small business owner and you and your employees are doing everything in your power to, you know, be safe. You're using disposable ketchup and mustard, you're wiping things down a lot more than before. You can't have people seat themselves, so now I'm paying an extra employee to seat customers when they come in. The amount of money that we just have to spend to stay safe, it's hard, just, you know, being small and knowing that at any time we can be dropped to 25%. That will be very detrimental for a lot of small business owners in Pueblo. Some people won't be able to, you know, open their doors again. I think the small business owners in Pueblo and the employees and stuff, we're not out there trying to break the rules. And, you know, if people are breaking the rules, they're doing it because they have to stay alive. And that's, you know, the only way that they will be able to keep their businesses, you know, by either going over the capacity or, you know, and all the small businesses that I've been to, they're really due diligent on cleaning and mask wearing. And, you know, I think the small business in Pueblo has really been doing their part to stay safe and to keep open. And so it's kind of like frustrating in that matter that we will be the ones that suffer the most, you know, once we move to level 3. You know, we've all kind of talked that maybe something that could be helpful to all of us, you know, once we do go to level 3 is, instead of having the COVID enforcers, that maybe we could have COVID supporters, to where they go to each individual business and you can come up with a game plan with the owner of the business, because nobody knows their business like the owner, to where, you know, maybe it's not 25 chairs, maybe some restaurants, take Brews Ale House, for example. I mean, that place is huge. Their capacity is probably 500, but to limit them to 25 or 25%, it seems like we could be doing a better job going business to business and helping the business owner come up with a plan, something proactive, instead of, you know, a complete shutdown or 25% and counting chairs. It really hurts, you know, too, once you've been criticized by the public, that, hey, this place isn't, you know, doing what they're supposed to be doing, or people think that because small business is the one that it's being affected by, that we're the cause of it. And we really need our city officials and our leaders to come out and say that, you know, it's not us. I know that there has been outbreaks at restaurants and bars and in some of the smaller places, but I don't think there's been any at gyms. And it's very unfair to us. And so that's just kind of the point that, you know, we'd like to get across. And we can't go through another complete shutdown. So, you know, if you're going to move us to 25%, if there's anything possible that we can do to, you know, make exceptions and help the businesses instead of hurt them, that's kind of what we're looking for.
Yeah, I agree, Heather. I don't think we have been able to trace outbreaks and things like that to the small businesses. As I say, I think they're doing a fantastic job, but it's their customers.
Right.
You know, probably not when they're in the small business, but when they're out there interacting, you know, with other people without face masks and those kind of things. And that's, I think, the message we need to get out. But thank you for that, Heather. Let me introduce Commissioner Garrison Ortiz. Garrison, you want to make a few remarks as we get this thing kicked off here?
Yeah, sure. Good evening, everyone. And I want to thank the mayor and the city for having me on this. This is my first time on here, so I'm excited to, as always, connect with the community, and welcome to, obviously, all the guests here. Couple of updates on the county side. Randy, or Director Evans from the Health Department, had mentioned this previously, but Pueblo County, along with our various community partners, to include the city of Pueblo, we submitted a mitigation plan to the state actually a week ago from today. So that was on October 29th. And Director Evans kind of hit on this a little bit, but we threw in everything that we possibly could that we thought would help us turn these numbers back, that would not adversely affect businesses. So I think we did a good job with that, to Heather's concerns, or we did the best that we could. One of the gauges that the mayor had mentioned that always gives me most pause or concern are the number of beds. To me, more than anything, that tells me what resources do we have to meet the challenge at hand. As you've heard, we're reaching that capacity, or have reached that this week. A couple other things I want to mention. The county has opened up. We've utilized some of our CARES funds to provide economic recovery grants for the small business community and also local nonprofits. We've done an award of $500,000 worth of grants We currently on the county's website right now are doing another round two $500,000 award. And we're also looking to be aggressive and do a third award here going into the fall, knowing that things are going to be really tough as patio seating and other restrictions are on our backs. I also wanted to mention that, we have, done some outreach with the business community. I really like the idea that was put forth about possibly customizing plans per business. I don't know if that's even feasible, but I think the reason we're all here, and I appreciate the mayor having us, is we're here to throw out ideas and see what we can do to work better together, because collaboration is what is the only thing that's going to help us turn these numbers around. So those are kind of some things at a high level from the county side, and appreciate the time, Mayor.
Yep. Commissioner, thanks for being with us tonight as we have this conversation with the community. And I know we got a lot of questions on Facebook now, but one that we got earlier, and I want to ask Dr. Urbina to answer this question. Dr. Urbina is the Chief Medical Officer at the Pueblo County Department of Public Health and Environment. But the question asked, Dr. Urbina, is, are those who are infected building immunity to this virus? And if so, is the antibody test more accurate than it was 6 months ago?
Mayor, thank you for the question, and I'm glad to be with this great group of people trying to answer your questions. So this is a very common question. And because this is a new virus, we're learning daily, Mayor, about its natural history. We think early on, at least, for the majority of cases, getting COVID-19 does establish immunity for a significant amount of time. It's likely to be months. Not everybody mounts an immune response, and that's expressed in terms of antibodies. And you remember a while back, Mayor, when we talked about antibody testing not being a very accurate gauge of whether or not the infection. And because we didn't know enough about the virus and we didn't know about people's immune response. So now we know that the antibody test is probably fairly accurate. But more importantly, we want to diagnose and identify those cases that are currently infectious. So the testing that we have going on at the fairgrounds and in our community with the local doctors and health providers is to test for current infection. So the PCR test, the swab of the nose, is the best test we know so that we can quickly identify those folks, send them home for 10+ days, quarantine all the contacts, and that's what Randy has talked about, contact investigation. So that's really where all the effort is going now, to establish those acute infections. And looking back, yes, we'll probably know that more people, as Randy alluded to earlier, that were infected. My dad, who's 93, had the infection. He recovered. He was hospitalized. He's doing quite well. If we were to test his antibody test, it'd be likely positive. Now, there's a change that's happening right now. The longer we have this disease, there are now reinfections from a different mutated change of the virus. So that's a little bit scary, because it's possible that you could get the infection again because of the change of the virus. So that's still, the jury's still out on that, but we still want to protect people. And hopefully I answered that question.
Dr. Urbina, one other question that somebody asked, and let me just read it. It says, no one is doubting the seriousness of this virus. However, forcing people to live their lives a certain way in fear of a certain outcome is no different than terrorism. Wouldn't it be better to let educated adults make their own decisions and accept the risk that they are comfortable with when it comes to how, where, and at what time they do business? You guys are in the public health sector. Talk about that a little bit.
Sure, that's a great question. You know, I'm a family physician. I've been a family doc for 40 years. And when people come and ask me for medical information, I give them the honest answer. And if I could do things that would help you be healthier, I would tell you that. I would say that to avoid catching this infection, you have to wear a mask, you have to physical distancing, you have to avoid large crowds, because the virus doesn't care who you are. And yes, you can make your own responsible choice. My dad didn't have that choice. He wasn't able to say, oh, no, I don't want that virus. I don't want to come in contact with that infection, because he didn't know who he came in contact with and how he got that infection. So yes, responsible people can make responsible decisions. And that responsibility means wearing a mask, doing physical distancing, washing your hands, limit your contact with larger groups. And I think if we all did that, businesses would be allowed to be open. Our community would be safer, and the most vulnerable, like my dad and people with chronic medical conditions, could be safer to go out into the community. And it's a simple act of responsibility. And I hope that people would say, yeah, my freedom to protect myself and my neighbors is about doing those prevention strategies that we talked about.
Yeah. John, what other questions have we gotten? Have we got anything else on Facebook since we've been chatting here about a lot of comments I know that are on there.
Can you see me? I'm having some
Yes.
issues. But, so let's go back to business for a second. And let me ask this to maybe Randy or the mayor. Why can the big box stores have 300, 400 people and small businesses are being penalized? And the question was specifically geared towards Black Friday and the anticipation of that. So I don't know if the mayor or Mr. Evans wants to talk about that a little bit. I'll put that up for a jump ball.
All right, well, I'll start, but I think they have capacity limits as well. Correct me if I'm wrong, Randy, but I mean, they're not allowed to have unlimited capacity in those large stores. And like everywhere else, they're required to wear masks. I've had some conversations with some citizens that have been to some of the big box stores, and they tell me that when they complain to the manager about customers not wearing masks, the manager says, well, we don't want to have a confrontation. And I think the point we need to make is that everybody's going to have a confrontation if we're going to get this virus under control. And a big box store and a small business is going to have to say to their customers, hey, you have to wear a mask. You can't, because if you don't, this is not going to be controlled. And I certainly intend to send our education and compliance people out to the big box stores. People I think that the big box stores got to stay open because they were big box stores, and that's really not the case. I mean, they got to stay open if they were a hardware store or a building supply store, just like a small hardware store could stay open, or a big grocery store or Walmart got to stay open, not because they were big, but because they sold essential things that people needed. But a small grocery store could stay open as well. I mean, when we went through that shutdown in March, it was sort of analyzing, okay, what are our priorities? What are the needs that people have? Somehow alcohol and marijuana got put to the top of that list, I guess, so that people could deal with the lockdown. But, that's sort of the situation. Randy, you got anything you want to add to that?
Mayor, I think you're right. And it is something, though, that we've called to the attention of the state and have asked the same questions about, not to penalize the big box stores. We need those businesses too, but we need our small businesses. We need our small businesses to stay open and keep moving forward. And we've asked the state to think about that and think about ways and strategies that could help us to help them stay open if we move into a more restrictive phase. I think it's difficult, and I know that it's difficult, especially because those larger box stores sell other goods that were not considered essential, and some of those small businesses that sold the same things, for example, bicycles or fishing poles or those kind of things, were not allowed to stay open. And so there's some question about that, and I think everybody recognizes that it wasn't maybe as fair as that could be, and I hope that the state is relooking at that. We certainly have talked about that and have tried to identify some strategies here. But I think that, overall, the intention and the work that was done early on with shutting down stores, it wasn't necessarily meant to be fair. It was meant to try to control the virus and do the best that they could. And so I'm not critical of anybody, but I do think that we need to look at that moving forward.
Well, one question from the email that I want to ask County Commissioner Ortiz this could you talk a little bit, we should receive this at over email over the week, the consistency between or inconsistency between city and county policy on handling the pandemic and businesses governed by each. There was some confusion after the curfew. So the question is for the county, could you explain to the people of the county a little bit how you approached it, and then maybe the mayor can talk about how the city approached it?
Sure. I'll do my best to answer the question. As I mentioned, we have a variance that we submitted to the state to try to allow not just the county, but the city and the county to continue to operate and be open to some extent. We have a city-county health department that has representation from both the county and the city. And so I guess the underlying point I'd like to make, and the calls that we had we have every week at 8 o'clock in the morning, those have city and county officials. So I guess my underlying point is our mitigation plan, our variance, the enforcement that we tried to put into place. I think we've done a pretty good job of doing that in a unified way. I would say that there are some different delineation of authority between the city and the county, but more or less the community will benefit from us cooperating and acting more as a team, especially with a city-county entity really at the center of all this. And I just want to note that the health department, in my opinion, has done a great job. But people need to recall that they're not the policymakers. They're here to execute things that they're given, that we're given by the state at this point. So I don't know if that answers your question. If the question is directly, did the county implement a curfew? No, we didn't. And actually, we have different authority than a home rule city does, and I don't even believe that we have that. We don't have that ability to do something like that legally, even if we wanted to.
Yeah, I would just want to agree with Commissioner Ortiz and say that we've tried to act in concert as a city and a county as we've dealt with this pandemic. Each of us has taken some different actions at different times. For instance, we were able to use part of our half-cent economic development fund to, in March and April, get some money in the hands of the businesses inside the city of Pueblo. The commissioners have now done that with some of the CARES money so that they're doing the same thing for those businesses in the county. We've really tried to cooperate and move forward as one community. Certainly, as he indicated, we have different jurisdictions, different authorities, different powers. I was somewhat surprised to see that the mayor could impose a curfew under civil emergency situations. And I determined that I would do that to try to get this turned around inside the city limits. And, whether it'll work or not, I think remains to be seen. But I get reports at least that, some of the bars are closing at 10 o'clock and that there are fewer people on the streets after 10 o'clock than there were before. So we're hoping that makes a difference. But generally, I think we certainly we communicate with each other regularly so that we know what we're doing, and we're cooperating in the terms of expending these CARES funds to make sure that we get the biggest bang for our buck from these monies that come to Pueblo County. So one of the questions that came up on Facebook now as I was just reviewing this for Randy or Dr. Urbina is, what's the plan if the hospital's capacity is exhausted? If we exhaust the hospital capacity, what's the plan for the community? They talk about those beds that are at auxiliary beds at St. Mary Corwin, but tell us how those work into this scheme.
So I'll start if Dr. Urbina wants to jump in. So yes, the alternative care facility that the state put a lot of resource in to build up at St. Mary Corwin is meant to be a step-down facility so that patients who have the needs have been met for them at the hospital level, but they're not yet ready to go home or be discharged to a nursing home or others, and they need some additional time and additional care. This step-down unit is meant for that. It is a very important piece of the strategy. And I know that at the state, they're having discussions about when exactly to open that up. But it really provides a pressure relief valve for the hospitals so that they can move those patients out to a lower level of care and then use those beds that they have for more serious patients. So that is a part of the strategy, and we are continuing to have dialogue with the state about opening those up. Dr. Bina, did you have anything?
No, that's right on, Randy. I think that our idea is that people that get COVID, particularly if they have chronic medical conditions like diabetes, heart disease, or lung disease, or over the age of 65, like myself, suffer for longer periods of time, and they can't necessarily go home, even though they're maybe not infectious. They still need hospital care. So I think this step-down unit is going to be helpful, so that the patients who need acute care and unfortunately may need an intensive care unit or a ventilator will use those very precious ICU beds at Parkview for those who really need it. Hopefully we can prevent this, but I think that's part of that mitigation strategy, is to do a step-down facility. Right now, we're still having outbreaks in our long-term care facilities, and I think we're still trying to struggle with that to try to prevent the infection by testing, as well as controlling or isolating the patients. But there's still a significantly number of people who unfortunately are affected by this disease that many of our audience may not see, who are suffering from the disease. And they're just looking at maybe the deaths or the ICU beds, but there are still long-term sequelae or long-term complications from this disease that may affect the heart, the vascular system, chronic fatigue. So this is not a mild disease. This is much more serious. And I hear this often, this is just like a strong flu. Well, it's not. It's much stronger. Maybe 4 or 5 times more people die every year, are dying from COVID, than have died annually from flu. So this is to be taken seriously. I know people talk about this. Let's just let it go its way. And I don't find that acceptable as a physician and a public health person. We can't just let this take its course. We have to do something about it now.
Yeah, it seems to me, Dr. Rabina, that one of the strange things about this virus is that it affects people in a different fashion, so that some people have it, they don't even know they have it. Other people might have mild symptoms. Other people get vastly ill with it. One of the things we learned in our conversations with the hospitals this morning at our regular meeting was that there's this assumption out there that the only people getting hospitalized are the people coming from the nursing home, and that's not the case. 67% of the hospitalizations at Parkview for COVID people are coming from their private homes. I mean, they're coming right from the community, not from a long-term care facility. So that's, I think, important for the community to understand that this is a serious disease, and everybody has to take it seriously if we're going to get through this. I mean, and how we deal with it, it seems to me, will determine how many of our small businesses survive and what we look like as a community on the other side of this. But any information about when we might see a vaccine? There was obviously some talk that after Election Day, this whole thing would go away. It was all just a hoax. But tell us what you can about the vaccines that might be developed and how long it might take those to help us out.
Sure, and I wanted to add a couple things, Mayor, and I will also answer the vaccine question. Fortunately, we're seeing, to kind of go along with what you were saying earlier, fortunately, we're seeing in younger people, the disease is more mild, which I think is good. I think maybe they have a capacity, a stronger immune system. They don't have chronic medical conditions. And I think that that's tremendous. It allows us to open up our schools with protections. And I think we can do a reasonable job to make our kids safer to get back to school, unless we see a significant change in that trend. Now, as you alluded to earlier, younger people are getting hospitalized. We've also starting to develop therapies that actually work. Steroids do help. Antibodies through transfusions do help. There are some antiviral drugs that actually do help. So all those things are developed. But that's part of a strategy to hopefully we can now mitigate or try to prevent the virus from in our community. So once we get the vaccine or vaccines, we can actually control the spread. Now, everyone knows about the influenza vaccine. Every year we have a different strain of influenza affecting our community. And by the way, you should get your flu shot. It's not too late. But if we're successful in developing a vaccine, which will likely occur probably at the end of this year, we'll probably have some of the earlier results and probably a vaccine available for first responders like physicians, paramedics, healthcare workers. Those will probably be the first that will probably be offered the vaccine, but not until next fall will we know completely if we have enough vaccine for everybody else. So I'm guessing summer or next fall that we'll have a vaccine. What I'm very worried about, and most of the health experts are worried about, is that because of the changing immunity, as we talked about earlier, will this vaccine have to be given every year? We don't know that yet. And so we're testing it, and that's why it's taken.
Uh-oh.
Did we lose him?
I guess we lost Dr. Urbina. John, have you seen any other questions there? Or?
Yeah, there's a good one that came in through email, and I wanted to go back to Heather, and it was from a fellow business owner.
Protect them. So we're talking about next year.
Doug, we might have missed half of that question, Dr. Urbina. So let me read an email that we had and go back to Heather, and maybe she can talk about her experiences, and I'll read it quickly. They're talking about the small business, and our industry has been dramatically impacted by the regulations imposed as a result of the pandemic. Many small business owners spent considerable amounts of time filling out forms for funding and operating with no timeline. And they've had restrictions in place, capacity, and other restrictions throughout the year. And the comfort of, if it continues, the comfort of patrons will be negatively affected long after. And you know, the question goes to, and maybe Heather can have some suggestions, and then the mayor, Garrison, can talk about it. But what is the government response to businesses, both for our restaurant industry and non-restaurant industry? That, Heather, the question to you would be, what would help you going forward as some of these funds and the COVID relief maybe isn't there? And then for the mayor and county commissioner, what can be done to help the non-restaurant and the restaurant industry going forward? So first to you, Heather.
So the government funding is great, but what a lot of people, I'm not sure they understand how that works. You know, still to this day, my 3 PPP loans have yet to be forgiven. And so these were, you know, loans that I took out on April, and now when you submit, it could be 5 months before you even hear back from the SBA if it's forgiven or not. So it's kind of hard to be the owner who's personally guaranteeing these loans. You're just digging yourself a deeper hole. I mean, if we were allowed to stay open, we wouldn't need government funding. We wouldn't need help. You know, we were all just getting along just fine before the coronavirus. And so, yes, the funding is great. It helps, but it is due back at some point. And so as we limit capacity or, you know, have shutdowns and we can't make money to pay back these loans, I mean, some of these businesses, restaurants and bars, they'll be out of business before their first loan payment is even due. And that's serious.
Just to follow up with the mayor or the commissioner, what can be done? And then that was the question.
Yeah, from the city's perspective, you know, I know there was a focus, the people maybe think there was a focus on restaurants and bars, and we did help a lot of restaurants and bars when the city had their economic development money available, but we helped a lot of other businesses as well. We put about $3.4 million into the community they were sort of large and small businesses, coffee shops, beauty salons, barber shops, you know, just the run of the mill, because our goal was to, obviously, it's important to this community and to the city that these businesses be vibrant and they're able to come back as quickly as possible, because that's what we depend on, sales tax. And that's for people to think that the city would want to close down businesses unless it was absolutely necessary is ludicrous, because that's our bread and butter, you know, is the sales tax that they generate. But sometimes we have to go through some tough times to get through this hump. And this is not going to last forever, I don't believe. If it's not going to last forever, but it's probably going to be with us through the first half of next year, as Dr. Urbina said, maybe a little longer. But hopefully we'll come out of it stronger, as I indicated. The city still has, I asked the city council, and we still have about $1.6 million available out of that half-cent sales tax money that we can use between now and the end of the year, if it looks like there's a program that we can do. So we're exploring and considering those kind of options, but we haven't come up with anything concretely yet. But like the PPC, some of the money that we made available to the businesses were in the form of loans. But I think we're due a year from, you have to start making payments a year from when you took them out. And we haven't had conversations yet about, whether we would forgive any of those loans or anything like that. But, I think we'll take a look at what the situation is when that starts coming due and make a determination that's in the best interest of the community. Because as I say, our one and only goal is to try to keep these businesses as viable as possible through the duration of this, so that they can be robust when it's all over. Because I just believe that Pueblo was on the cusp of booming when this hit. I mean, we had things lined up pretty well, I think, and you never can predict what's going to happen. So those would be my comments.
Commissioner, can I go ask the same question to you? What is the county looking at assisting both the restaurant industry and non-restaurant industry moving forward?
Yes, I'll just say all sectors of the business community, big, medium, and large, are all equally important, and equally important to our local economy and ensuring city and county finances are sustainable. What I would say is the economic recovery grants that we're doing, I believe, are helping, but they only go so far. We can only inject so much money into these businesses to keep them going. In my opinion, I guess what I see is a shift, and this was mentioned a little bit earlier in this meeting. Is I think we're going to need to evolve some of these regulations to customize them or adapt them a little bit, if you will, to a particular business, because sometimes arbitrary distances, 25 feet here, 20 feet here, that doesn't always suit every building, every business, every situation. And so I think we may need to look at possibly giving the health department more resources and maybe more latitude to be a little more customized in their approach to things. And they've done a heck of a job with the resources, the limited resources that they do have.
I'm going to go to a medical one, and this was from Facebook, and I'm going to kind of jam this into a couple of questions. Could Randy and Dr. Bina talk about testing? There's some questions on testing results. There's some questions we had during the week on the accuracy of the test, the differences between the tests that are available out there. And the other question would be, can anyone get a test? So could you briefly give the community more information on testing and then testing results and what we're seeing out there? And I'll go to Randy first.
Hold on. So, John, I will let Dr. Bina address the different kinds of testing. He's very well versed in that and understands the nuances of the testing. But we have a community-based testing site. That site is provided to us by the state. It's actually costing the state somewhere in the neighborhood of $250,000 a week right now for all of the tests that are being done. That is free to the community, and we encourage people to come and get tested if you've been exposed, if you think you've been near someone who's positive, if you have symptoms. Any of those reasons are reason enough to come and get tested. It's a low barrier testing site, meaning you don't have to have a doctor's note. As I said, there's no charge for that testing, so it's it's available to our community. We've expanded hours to try to create access for people after work, and on the weekends. We do have some hours on the weekends as well. So We encourage anybody who's feels like they have been exposed or knows that they've been exposed or has symptoms to come and get tested. Dr. Urbina?
What, just real briefly, one question that they had is, if you don't have symptoms, they're uncertain whether they can get a test or not. We had this question pop up multiple times. Could you just clarify, either Dr. Urbina or Randy, will you be refused testing if you don't show symptoms?
No, you will not be refused testing. I would like to just point out, and Dr. Urbina will probably highlight this more, but that test is a point in time test. So it is a picture, a snapshot of what if you are positive on that day. It doesn't necessarily predict what it'll be tomorrow. And sometimes if you're asymptomatic and you get tested, you may not have the viral load that triggers that test, and it can give you a false sense of security that you're negative when in fact you could actually be positive. So I'll let Dr. Urbina expand on that if he'd like to, but yes, we won't prevent you from getting tested. It's just not, it may not be as accurate as it could be if you waited for a few days.
John, I'd be happy to answer that question. I apologize to the audience. For some reason, my internet connection waffled there for a second. So there are 3 types of tests. Please raise your hand, John or Bobby, if you can't hear me or you lose my connection, and I'll turn off my video. First is the gold standard, which is the PCR test. That's the nasal swab that takes a couple days, usually 24 to 48 hours. That's a very good test. It's diagnostic. All the hospitals, primary care providers, and we offer that test that Randy is talking about free. If you go to your doctor's office, it's going to charge you, but it's offered free, and we have expanded hours. That's the gold standard. The second test is the Anagen test, and those are popping up. They're new tests. They're called point of care antigen tests. That doesn't test for the RNA or the nucleic acid. It tests for the proteins around the virus. It's a fairly good test if you have symptoms or you've been in contact. It's very reliable and pretty accurate if you have that, if symptoms and or you have a contact. Now, it's not a great test if you're asymptomatic, because the reliability, the accuracy of the test is not that good for folks that are in that low risk category. So the final test, so it's be suspicious. If you're concerned about confirming that test, get a PCR test. If you have symptoms or contact, get an antigen test, and that's those results are pretty rapid, 15 to 30 minutes in a doctor's office. The final test is an antibody test, and we talked about that earlier. I wouldn't encourage anybody to get an antibody test because we're trying to prevent and accurately determine if you're infectious now. Looking back, it's probably less relevant at this point.
Could we go to the curfew a little bit? We had some questions on this and the data that we could see from that. Can we see some impact from both the health orders on Friday and the curfew that was instituted over the weekend? When can we give the public some information on when we will see an impact from those 2 instances? I'll go to you first, Mayor.
Well, I think we'll have an idea in 3 weeks or so whether it's had an effect on our numbers. I think we know that it's had an effect on people being off the street and not socializing out in public. We see that because our officers have noticed that and reported that to me, that there's a lot less activity going on downtown than there was before. But I think it'll take 3 or 4 weeks or so before we'll know whether it'll have an effect on our numbers. And as I indicated, this is sort of an interim step that nobody wanted to take. But one of the things that we found statewide, the infection rate, the people that are getting infected the most is that group of people between 20 and 40 or 50 years of age. So those tend to be the people that are out late at night, at the bars, maybe over consuming alcohol. That old country song, the girls all get prettier at closing time, and your judgment gets a little clouded during that. And I think this isn't going to cure the problem, but I'm hoping that it will send a message to the community that we have to take this seriously. This is, it's a message as much as anything that we really have to deal with this, or we're going to be in a lot worse shape than, staying at home between 10 p.m. and 5 a.m. So that's the best I could answer that. I think it goes to that group of people that's out at those hours. Most people in Pueblo aren't out during those hours, and so I think it doesn't have a dramatic effect on most people. It's hopefully will have an effect on those people that are most prone to the infection based on the data that we're getting from the state.
Randy, same question to you in terms of when do you think that we could start seeing a turn if it does happen, or what are you eyeing for the next couple of weeks and to look at?
Well, remember the numbers that we're seeing today are a reflection of what happened 2 weeks ago. And so you need at least 2 weeks to even start to see a change. And I would pose that it's probably closer to a month or 6 weeks before you really know if those things are having an impact. The unfortunate part about that is that the way the growth of the virus and the spread of the virus in our community is going, we don't have the luxury of time on our side to really wait that long before we make additional recommendations or changes. So it's a tough one, but I think at least 2 weeks at a minimum, and probably more like 4 to 6 weeks before we really know how a particular intervention has played out in our community.
I'm gonna go back to Heather on this one. Heather, there's a lot of positive comments for what you said tonight. So the Pueblo Facebook is happy with some of the points that you made. But because you also own a non-hospitality related business, we had another question, and I think this might be best coming from you. What do you see the opportunities or struggles for those non-restaurant businesses going forward, since you talked a little bit about it, and if you want to talk about your non-food industry business and give people what you're experiencing on that side of the operation.
Okay, so right now Pueblo is so great about going out and supporting your local restaurants, buying gift cards. That's what people are doing when we're out there preaching about Pueblo business. They do really think it's just the restaurants and the bars, and that's not it at all. I see it firsthand, at the Pueblo Athletic Club. The amount of members that we've lost just because they don't feel safe coming here anymore, going to any gym in Pueblo because they feel that it's unsafe. The other businesses, besides restaurant and bars, they're probably taking a little bit more of a hit than we are, because we are so, like I said, people want to come out and they want to support bars and restaurants, but you don't even think about the smaller places or the gyms. People aren't out there buying gym memberships right now because, there's a fear that it will get shut down. And I know that they did change the thing for gyms where it's kind of going to be like restaurants and bars now, where it's 25% or 25 people per room. But, you look at the establishment that we have here, it's over 5,000 square feet. And so having 25 people here really won't do much for us. And how can you, tell your customer base that, these are we have thousands of members here. How are we supposed to let these people utilize our gym with the hours that we have? We can't. It's unrational to try to do that. If that makes any sense to you guys, with kind of how gyms work, but that's kind of my point with that.
And this question would be for the mayor or commissioner, and it's the same question but posed to you. Is there we had a couple email questions on Facebook. Is there a plan going forward, or is there additional opportunities for the non-hospitality related businesses of Pueblo and Pueblo County?
I'd like to add something. Can you hear me okay?
Yes, go ahead.
Okay. As I stated, we're going to try to be as aggressive as we can with these economic recovery grants and ensuring that they're grants and not loans. But another platform that we developed with the generous help of some local marketing professionals probably 6 months ago or so, that we are trying to transfer to the Latino Chamber of Commerce is called Supporting Pueblo. And so it's an e-commerce online website for the non-restaurant and bar establishments, that if you have a product, food, good, or service to sell, the Latino Chamber of Commerce is currently having that transferred over and ramping that up, so you could list your product, good, or service there for sale.
Let me take a crack at it too. I think, how we can help our local businesses is by getting this infection under control and making sure everybody recognizes what kind of a problem this is. Because let's assume we don't have any lockdowns, but the infection's out of control in the community, and 1 out of 5 people has instead of 1 out of 100. I think you don't understand human nature if you think people are going to go out to restaurants or they're going to go out to businesses if the infection is that out of control in the community. We're just not going to take that kind of a chance, especially if you're like me and you're older. Now, some people might, but I think it's the key, I think, to this is that we get the infection under control. That's how we're going to make sure that our businesses can stay open and be as healthy as possible. So that's where I think we need to direct our efforts, is making sure that all of our customers and all the people in the community are following the rules that are pretty straightforward. I think if everybody wore a mask, and there are events where people don't wear masks, and somebody needs to call them on it and say, hey, this is not the way we ought to be behaving while this infection's around there, because if we don't get it controlled, I'm going to have to shut my business, or I'll have my business open, but I won't have any customers because people will be afraid to come in. I think Heather alluded to that a little bit in terms of the gym membership and stuff, that some people are a little reluctant to do that right now. So I think that's how we can really, really help our businesses to get this under control.
We've hit about an hour mark, but I just wanted to ask everybody if they wanted to keep going for a little bit more, and we had a lot more questions. So it's Mayor, what do you want to go for another 15?
Question here that I thought was interesting, and we haven't talked about this. We haven't talked about schools much, but somebody posed a question there is, why, if we have to go back to restrictions and restaurants are limited to 25% of capacity, why don't we limit schools to 25% of capacity? Talk about what happens maybe if we have to go back a level to that level 3 to our school system and things like that. And it seems that I think everybody agrees that's a priority, that we need to do everything we can to keep our students in school. But again, the way we do that, I think, is by getting the infection under control. But Randy, you want to address that a little?
Yeah, absolutely. So we've had really 3 goals going into this, and that have really remained since we started. 1 was to keep our community healthy. 2 was to keep our businesses moving forward, not sliding backwards. And 3 was to keep our schools open. And I think that it's really important that we try to keep our kids in school and give them some normal structured activity and learning. I think that school also provides an opportunity for parents to continue working as well. It is important that we keep our kids in school from a variety of health reasons as well. We know that many of our kids in our community rely on those school lunches, for example, and those school meals. We know that those social and emotional needs are often met through school resources and those kind of things. So it's really important that we try to keep our kids moving forward. I think that the other thing to know about schools is that even though schools are open, we're seeing very, very, very little transmission in schools. What we're seeing is that particularly, we're not seeing a lot of transmission from students to faculty. But we are seeing transmission from faculty to faculty after they've been out at different events and things in the community. So schools are very safe. They're doing a fantastic job of managing this and mitigating it. They've increased their cleaning. They're mandating mask wearing. They're taking temperatures. They're really monitoring this quite well and doing quite a phenomenal job with that. And so, as Dr. Urbina said earlier, that's also some of our lowest risk group, especially in that K-5, even through middle school. We see that the risk of transmission is much lower. So I think it's safe to keep our schools open, and I think we want to try to keep our schools open for a number of reasons, to support our parents and to support those kids who have other needs beyond just the learning piece.
Dr. Urbina?
Yeah, go, you have your hand up.
If I could just add to what Randy said, right now, the schools have done a tremendous job, and we're really working closely with them, sharing infection fighting or control strategies. They've done an excellent job of requiring masks when the kids are on campus, doing physical distancing, of hand hygiene, disinfection, mechanical ventilation, and keeping the groups small, which I think is also a kind of microcosm. If we did those same prevention strategies out in our community, like we're doing in the schools, I think we'd be a lot healthier in terms of maintaining a healthy community. So I think they're connected. Our community is connected to the schools. We have healthier community, we have healthier schools, healthier community, healthier businesses. We're all interrelated. And if we can all practice those and take personal responsibility, as we talked about earlier, Mayor, if we can all take responsibility for the behavior, and it doesn't hurt to wear a mask, as you know, and we can actually be a safer community so that businesses, our hospitals, our schools, we can all thrive in a very healthy environment.
You know, I want to be respectful of our guests' times. We asked them to join us for an hour. This has been a very, very robust discussion, and the interaction on Facebook has been very good as well. I'll certainly let anybody make any closing comments if they like. Anybody want to say anything before we close it out? I think that
I just wanted to thank you for having me on as a guest. Really appreciate the opportunity, and obviously we have certainly a lot of work to continue to do together, and really appreciate the outreach from the small business community and just everyone's efforts. Thanks for having me.
Absolutely. Right, Heather, thanks for being with us. Dr. Urbina and Randy, thanks for being with us. We're going to get through this, Pueblo, together. And as I indicate, you know, how many of our small businesses can survive this, I think depends on what we do today. Each of us has to take that action that's necessary that we know is necessary to slow the spread of this virus so that we can come out of this as a stronger and better community on the other side. So I want to thank you for joining me and my guest this evening for this community connection. I think it's been a terrific meeting. Heather, thank you very much for joining us. And we'll see everybody next month. We might have to get this panel together and do it again because, as I say, it's been very interactive. So thanks very much, everybody, and see you next month.